Welcome to Dental Heroes. I'm Dr. Arash Hakhamian, the modern dentist, on a podcast that focuses on entrepreneurs, incredible clinicians, local heroes that are not only changing dentistry, but changing the lives in their community and for us all. And today we have an incredible doctor, Dr. Rashi Vohra, who we're really excited about talking about dentistry, about her career, about how she's changing dentistry, and really why she's been chosen as a local dental hero in her community and what she's doing, not only with her office and her patients, but really in advancing her area of expertise and the lives of the patients, and also how she's teaching dentists and helping them advance their careers and better serving their patients. So welcome, Dr.
Thank you,
Vohra.
Dr.
Thank you for
Raj. That was a
coming.
very nice introduction. Appreciate it.
Well, I've had the pleasure of knowing you for uh, well over a decade now.
Right.
I've referred a lot of patients to you when I was practicing. I remember the important patients or the difficult cases. I want to make sure we get it right. I would send to you, and so I've seen firsthand um, how incredible you are and
Thank you.
how
Thank you for your kind words.
exceptional your care is. So, congratulations on being invited.
Thank
And
you. Thank you for having me.
yeah, so tell me a little bit about about your past, about your how you even got involved in dentistry, why you got involved in dentistry. What's your why? What's what precipitated in you going into dentistry?
Sure. Just to begin with, I have been in dental field for more than 20 years. What motivated me was my sister, my older sister. She's a dentist as well. So I always, followed her, always saw her, how she treated her patients. So I think to begin with, that's what motivated me to be a dentist. So a little bit about myself. I went to dental school at the UCLA School of Dentistry. I graduated as a general dentist. I worked as a general dentist for a few years, and then I went back to become an endodontist, which is, a root canal specialist. And that I've been doing it for more than 10 years now, and I love what I do.
Amazing. So dentistry runs in your blood. You have
It does.
it's a family affair.
Yes, it is.
That's incredible. And so your sister is
My
also a
oldest,
dentist.
yes.
Okay,
Yes.
amazing. And so just for our audience, so you not only graduated as a dentist, but you also went into
Yeah.
a specialty, which means you did all of the general things that dentists do, but then you went again to additional schooling to become a specialist on top of everything that general dentists do.
Yes, so, that's what my passion was to, save people's teeth and to get them out of pain. It's very rewarding, when a patient comes to you with pain and then you take good care of them, take them out of pain. So that's how I chose endodontics.
So general dentist can do just about everything, but not everything extremely well to the level of the specialist, right? So you know how to do fillings and cleanings and all the stuff general dentists do, but when it comes to taking people out of pain, when it comes to the difficult procedure, one of the most difficult in dentistry, which is root canals, you are exceptional at that. You actually had additional training. Like, how many more years of school do you have to go to
So,
become an endodontist?
sure, I had to do 2 more years of
Okay.
additional training, and I'm board certified as well. So after I did that, I had to take 3 more exams and do my case presentations to be board certified and become a diplomat of American Board of Endodontics.
That's incredible. It's a huge honor. So there, I would say less than 1% of dentists are a
Yeah,
part of
not
this.
many people, because it's optional.
Okay.
It's not a requirement to do that, but that's basically pinnacle of my career. So I wanted to reach the peak and do whatever was there to be exceptional.
That's amazing. So basically, not only can you do what general dentists can do, but I mean, fillings, cosmetic dentistry, extractions, but you can do root canals with advanced training, with advanced equipment and materials, as a board certified diplomat in ways that most general dentists couldn't do.
Yeah, that's right. Because I wanted to be exceptional. I wanted to get everything that's out there to be the best in my career.
So Basically, I think root canals, for those who don't understand how it works, is it takes you out of pain and it allows you to keep your teeth instead of having to pull a tooth that has an infection or a tooth that has been compromised. A root canal procedure allows you to save your tooth and continue to use it in regular
Absolutely.
function for many, many years. Tell us about that. Tell us why are we able to do that? How are you able to do that? And why people should see you if they've been told they need to take a tooth out, why should they see you, and how do you save that tooth, and what does that mean for the patient?
Of course, most of the patients, they come to me when they're in a lot of pain, which means, if they have a decay that's close to the nerve, or they have a crack or fracture, or there's a big infection. So, in all those cases, we can definitely save the tooth, but not with just a filling or a crown. So, if the tooth is infected, we have to remove that infected nerve. That's basically what the root canal entails. You drill a small hole, you remove all the decay, you take out the infected nerve, you treat the tooth with the antibiotic solution while you're working, and then you place a nice filling, that goes basically in the place where nerve was, so that the tooth is well sealed now, and no bacteria can get in. So this way, rather than extracting the tooth, we are keeping it. The root canals, they have pretty high success rate, 94, 95%. So as an endodontist, I would do every effort to keep your tooth basically.
So what happens when someone loses a tooth? What are the things that occur after losing a tooth, and why should people save their teeth?
There is it's like your own part of your body. It's always nice to save each part of your body. It applies to the tooth as well. If we keep our own tooth, we save the bone, the gums stay healthy. There are different options. If we have to lose the tooth, you have to lose the tooth. But you try to keep it for, as I said, saving the bone. And then, once you lose the tooth, you have to replace it. It's a different, entirely different ball game. But we can talk about, more what are the options to replace, once the tooth is extracted as well.
So if a tooth is lost, what happens? I've heard that the teeth shift, and you put more strain on the adjacent teeth. What happens when someone loses a tooth?
Yeah, that's right. So now we're looking at an empty space. The other teeth are going to try to close that space. If we lose a bottom tooth, the top teeth are going to start growing down. Same thing, if we lose a tooth, the adjacent teeth are going to shift towards that, and you try to close that space. So what that does is, now when we chew, the forces are not parallel, or they're not along the long axis of the tooth, and it's not good for the tooth's health. You can start having problems with your gums, you can start having problems with your bones. So it's really, really important to replace if you lose a tooth, so that you don't get into all those things.
So if someone loses a tooth, how long after losing the tooth should they wait before replacing that missing tooth?
Just all it takes is 4 to 6 weeks of healing time, so that the other teeth, they don't shift into that space. I would say, as long as, as soon as the gums heal, I would go ahead and get into the option of replacing it.
Before they start losing bone and
Yes.
before the other teeth start
Hmm.
shifting.
Hmm.
So sometimes the patients look at a really damaged tooth and they say, this is beyond saving. And people like yourself who have such an incredible experience saving teeth can oftentimes look at a tooth and say, no, I can save this. You can use this for years to
For
come.
sure.
And we don't have to lose this tooth and spend thousands on replacing it with implants or shaving down your adjacent teeth. Tell us about some of this experience you have in saving teeth that other people would, find unimaginable to save.
Yeah, I know exactly what you're saying. Yeah, sometimes if there is a lot of decay, there is not enough tooth structure. Other people, they might recommend extraction. But as I said, I'm big on saving teeth. So, first I will clean out everything to see how much do we have. Then we have options of post. If you don't have enough tooth structure, we'll go ahead and do the root canal. Post is basically a screw in there, we put in to retain your crown. So we will do everything possible to save your tooth. Or we can go for a crown lengthening surgery, which means, we can increase the length of your crown by just, shaving your gum and bone down a little bit so that we have more length or more tooth structure to work with now.
So if someone looks at a tooth that has a hole in it,
Hmm.
they shouldn't assume that that tooth needs to be
Not
pulled.
at all. Not
Okay.
at all. Yeah, I would take an X-ray, see how much bone do we have around it. How healthy the gums are. Can I work with placing a post on this tooth and still be able to save it?
So you can take a tooth that looks very damaged and actually clean it, clean the inside, build it back up, and then restore it so that the patient can use this tooth for 20, 30 more years.
Of course, because we have advanced materials, we have advanced technology. We can do a 3D scan in our office to see, what are we dealing with. With all those, advanced equipments, I think we can make a very good decision for a patient.
So I believe that root canals, when done properly, are done by a specialist. So I personally wouldn't really rely on general dentists who don't focus on root canals as often to do
Hmm.
to do a advanced root canal procedure because sometimes the teeth have more canals than we are able to find as a general dentist.
Of
You have
course.
advanced training in being able to find all of the little nooks and crannies where bacteria get stuck.
You're
Tell us
very right.
about that. Tell
Yeah.
me a little bit about why it's important to have a specialist do a procedure and what type of improved success rates we see when a root canal specialist does it in contrast to a general dentist.
Sure, it's amazing, how much advanced technology we have. So before we start any treatment, we normally do a three-dimensional scan. Most of the teeth, they have like 3 or 4 canals, but the additional information we get from the three-dimensional scan can really help us look at the anatomy of the tooth. What instrument would best, fit into that? What material should we use? I think that, and then, enhanced magnification. You go to school for additional training, yeah, you have the skills, but all these advanced equipment and technology, it really helps us, as I said, dimensional scan and the enhanced magnification, which I can see. I sometimes wear magnification which is like 8.5 times more than the
Wow.
naked eye. So that really helps me, to see the nooks and crevices, you mentioned about, because cleaning those nooks and crevices is really important because that's where the bacteria, get in, and that's where they harbor themselves, and that's what causes the infection later on.
On a microscopical level.
Oh, yeah, for sure.
Yeah. So tell me about this technology, this 3D scan. Like, what does it do? Because I know most offices don't have this type of technology that you have. So what does it do? What is a 3D scan? Why is it important? And why isn't everyone using this?
For endodontics, it becomes especially important because we are working inside the tooth. We can't, when we look at a tooth, it's two-dimensional, or even if we look at an X-ray, it's a two-dimensional image. So we want to look inside the tooth, and that's only possible, with the three-dimensional scan. Or if there's infection in a tooth, we want to see it three-dimensionally how big the infection is. Does it even make sense to go and do all the treatment, that's needed. So it's basically helps us in diagnosis or treatment planning as well.
So it sounds like a super X-ray.
Oh,
It
it
sounds like an
is.
X-ray, but with an additional dimension.
Yes, that's
And
very true.
so are you able to save your patients from undergoing procedures that are bound to fail by being able to use this 3D scan? Where if someone is just looking at regular X-rays, they may think that this tooth is savable, but because you have this 3D imaging, you can now see cracks and fractures,
Mhm.
and tell the patient from the beginning, don't waste your money. Don't spend this unnecessary money trying to save a hopeless tooth because it's bound for failure.
Sure. As I said, let's talk about infection. If you see in the two-dimensional image, uh, it might not look as big as it actually is. So three-dimensional image is like actual size of the infection. So when you look at that, you see how much bone is damaged. Because when we do the root canals, what is the outcome? A good outcome is for all that missing bone to fill in. But if it's such a big area of bone loss that we can only see from the three-dimensional scan, I can definitely diagnose better and treatment plan better because because if let's say the area is more than 5 millimeters, 6 millimeters, then I know it's gonna take forever for that bone to fill in. I don't want patient to go through that and keep waiting for infection to go away. In that case, I would rather tell them, I think it's better if we pull the tooth and place a more predictable option to replace it.
So tell us about why dental infections are important. From my experience and learning from you, I've realized that some infections can actually kill you, right? Some of these infections can increase in size and cause an abscess that blocks the airway, and like you won't be able to breathe. And so it's important to address these early on. So tell me a little bit about the importance of addressing problems early,
Sure.
what you do to decrease the infection, and how this can potentially impact someone's life.
Yeah, definitely. So there are different scenarios. Let's talk about a top tooth. It's common, if the infection gets bigger, especially in the top front teeth, the infection can transfer to your brain, believe me or not, because, the veins in this area of face, they don't have walls. So, infection and blood can actually transfer to your brain and be life threatening. Same thing with the bottom teeth, because we have these spaces over here. If the infection, goes through those spaces, it can, get into your bloodstream and be life threatening.
Wow.
Yeah, another thing, bacteria from the gums, they can actually get into your blood and, cause you heart problems or brain problems.
So you're saying the bacteria and infections from the teeth can actually
Yes,
travel to your brain.
yes, definitely.
And so how about if it doesn't hurt? Can you still have an infection even though there's no pain? Tell us about that.
Yeah, it can, the tooth could be infected. You might not have had any pain because the bacteria, they go through phases of inactivity and activity. If they are inactive, they're just sitting there, they're, eating up your bone. In that case, you might not have pain. But, once they flare up, that's when, you get swelling and pain. And sometimes that's, it's too late by then. So that's why we say, the regular dental visits, seeing your dentist every 6 months, taking your x-rays, that's why it's very important so that we can catch those things early before we get to a point where, we cannot do anything but to pull your tooth.
So let's talk about acute infection. So tell us about your experience. People just waking up in and
Mhm.
all of a sudden, yesterday they were okay, and today their face is half swollen. Tell us about how this works.
Yeah, you're absolutely right. Sometimes a patient wakes up in the morning and they have their whole face swollen, while they were like perfectly fine at the party last night. Yeah, that could happen. Two things, it could happen if they have a deep cavity and, slowly bacteria traveled through end of their root and all of a sudden, there are bacteria everywhere and they get swollen. So that's one. Or it could be an old infection, which was missed, or, patient hasn't seen their dentist and it's been there for a while. All of a sudden, maybe when if your immunity is low, those bacteria, they can flare up and then you can have an acute episode of, which we call, abscess. Yeah, you can have acute episode of that infection.
So when people have these infections, what are the early signs and symptoms? Tell us, is it sensitivity? Is it cold sensitivity? Is it sweet sensitivity? Tell us a little bit about early signs and symptoms that people should be aware
Sure.
of.
So some of the early signs and symptoms of infection would be, it's a process. It starts with, let's say, cold sensitivity, cold and hot sensitivity, anything you drink or eat cold, you will feel pain in the tooth. That's very early, Sometimes we can save that or, that can go away with just a filling or a crown, okay? So if we don't do anything, if we keep ignoring that cold sensitivity, so the second stage sets in, which means now the bacteria get in. So in that case, patients would not feel any sensitivity to hot and cold, but their tooth will be very tender when they chew on it, when they put pressure on it. In that case, it's far, too far gone. Basically, we cannot do a filling, we cannot do a crown because now the nerve is infected. So in that case, we have to go in and do a root canal, which means we have to take that infected nerve out, clean everything, and then, basically place the filling. So I would say, whenever a sensitivity or anything starts, I would go see a dentist right away, so that we don't get, though I'm a root canal specialist, but so that we don't get to a root canal and we can save your tooth, without a filling or a crown. But if the infection sets in, then definitely we have to go ahead and do a root canal.
So tell us the difference between lingering pain or sensitivity and one that goes away, and what that means.
The way I would explain, if we can get away without a root canal, is, by doing a cold test. Basically, if I put, some cold spray on your tooth and the pain goes away within, a few seconds, let's say less than 5 seconds, then we can get away without a root canal, which means we can just go ahead and do a filling and you will be fine. But if that cold sensitivity lingers on for more than few seconds, or let's say, 15 seconds, then we have to jump in and do a root canal. Basically, that's how I would differentiate. But if we ignore that, 15 seconds cold sensitivity for a long time, then the infection is going to set in. The treatment is still going to be, root canal, but the prognosis of that treatment, comes down, if the tooth is infected. But if you keep on waiting longer, then the infection is going to eat up a lot of your bone, and we're going to get to a point where we can't even, you save your tooth with the root canal.
So it all starts with some type of sensitivity.
Yes,
Usually most people will
of the
be,
time.
they'll be sensitive to to hot, cold.
Mhm.
Now, if that sensitivity after you have like a cold drink goes away quickly, there's still a chance to prevent the root canal.
Yes, absolutely.
But if you wait longer, that will linger, right?
Yes.
So that cold sensitivity, instead of lasting 2 seconds, will last 10 seconds.
Mhm.
The longer that lingering, the worse it is. And that
Yes.
means that your nerve is more inflamed.
More inflamed.
And so you're more likely to end up needing a root canal.
Mhm.
Got
That's
it.
true.
So, and if you wait even longer and you don't fix the problem, sometimes all that sensitivity ends up going away and you think,
Yeah, it goes
"Great."
away for the wrong reason, because now the nerve is dead. It's
Dead.
infected. You are
Right.
not, you don't know what's going on, but bacteria are doing their job.
So there's like this war between the bacteria in your teeth. Initially, your tooth says, "Hey, something's wrong. It's sensitive." And then that's the time to fix it.
Right.
Right?
If we ignore it, then, problem keeps getting worse and worse.
So then it starts screaming louder, the sensitivity gets worse, and at some point, the tooth loses the war.
Yes. Yeah.
So no more pain, but the battle still continues.
Right. And that's when you see, most of the patients, because, we kind of ignore those little warning signs.
Correct.
And we get to a point where there is no going back and we have to jump in and do the root canal. So that's why it's important to do your, regular visits. Don't ignore, if anything unusual is happening, and, see your dentist so that we can give you treatment, on time.
So dentistry is no exception. Like, you can't feel blood pressure, right? So you have to check for blood pressure. You can't feel your, your maybe levels of diabetes. You have to check for that.
Mhm.
So when it comes to dentistry, it's not exception. You have to check for things that you can't feel, which is why we take x-rays, right?
That's right.
So you can find these things early on, before they get out of hand, and tell
That's
the
right.
patient, hey, these are the problems that are occurring. This is what you should do to prevent it.
Absolutely. Absolutely.
Yeah. So there's, tell us about why it's important, I guess, then not to wait until there is pain to go to the dentist. When should most people see a dentist?
Every person should see a dentist every 6 months at least, so that we can take new x-rays, and see if there is any decay or a crack, any changes in the teeth, so that we can, catch the problems early on and we can avoid, more invasive procedures. So I would say 6 months.
Every 6 months,
Every
someone should
6
see a
months.
dentist. Okay.
Yes.
And what if that person is more cavity prone, or they have, gum disease more often? Do people see, a dentist more often?
Yes, that's a good point. Every person's susceptibility to decay, cavities, and gum disease is different. So, we evaluate, at every visit how their gums look, how prone they are to cavities. So sometimes they put those people who are more prone to these on 3-month, maintenance calls as well.
Okay. So tell us about crowns. What are they? Is it only for royalty, or Why do people get crowns, and what do crowns do for us?
Yeah, I wish they were for
For
royalty, but
royalty, right?
yeah, so the crowns basically it's a cap that covers all the surfaces of your tooth. Not every tooth, needs a crown. So basically, we evaluate how much damage do we have on the tooth. If it's just a little crack, small decay, we can just get away with the filling. But if it's a big decay or a big crack, and we do a filling with all the chewing forces down the line, the tooth is just gonna break. So to protect the tooth, we put a cap, which is crown, to cover all the surfaces so that it's strong enough, and then it can bear the chewing surface, and it can bear the chewing forces.
Okay. And how are crowns made?
So there are a couple ways, the crowns are made. One, what we do is we shave your tooth down a little bit to create space for something to go on top. For that, we take models or impressions of your teeth and, send it to the lab, and lab makes them. So basically we get them back in 2 weeks and we give you that crown. Or we can always do in-house crowns, which is, you're right there. We shave your teeth down. We scan the image of your tooth, and we have a milling machine basically that mills the crown right away, and you get your crown, same day in an hour or so.
Amazing. So the crown uh, basically protects your tooth so
Mhm.
that you can continue to chew normally. Can
Yes.
you chew regular foods on there? Can you have a hamburger? Can you have steak on a crown?
Yes, yes, you can have all those things. As I said, these we have like advanced materials. We have zirconia crowns. We have Bruxer crowns. All those crowns they are very strong, and then you can chew anything you want. You can chew nuts. You can have hamburgers, or because of their strength.
So let's talk about that. The material that you guys use is significantly more biocompatible and is not as harmful to your body because the quality of the material is important, which is something I'm a huge proponent of. Like, tell us about what type of materials you use and why you use those types of materials to make your crowns.
Sure, we the materials we use in our office they don't have metals anymore because metals are not very biocompatible or they're not very good for the gums. So we have metal-free materials, which is porcelain, zirconia. All those materials they are thin, which means we don't have to shave your tooth down a whole lot, and they are very gentle to your gums. They don't cause any gum inflammation or gum problems.
Yeah, I've seen some people who have their gums that change color,
Hmm.
depending on, the type of fillings or crowns. What
Sure.
type of material do you guys use, and why does that happen? Is it corrosion? Is it like, what is happening that's causing this, and how do you guys see that with your crowns?
When we see our patients, as I said, we don't use them anymore. But I know what you're saying. The patients who had metal crowns or porcelain fused to metal crowns or old metal silver fillings, yeah, those metal fillings or crowns they have metallic components that leak, and that's what basically discolors the gums or the cheek area.
So tell us a little bit about why people, their teeth. I know you were teaching me about trauma and the fact that, these teeth change color over time. So
Hmm.
tell us about that.
Sure. So when you have a trauma, it's like any, trauma to anywhere else in the body. So whenever you have that impact, we have little tubes inside the teeth. So the bleeding happens, and those tubes carry the blood to the outer surface of the tooth. And that's what basically causes the discoloration. Again, to get rid of that, first we have to go ahead and do the root canal, which means we have to take all the debris out or the infected nerve out, and then bleaching is another procedure that we can do to get rid of that discoloration. Basically, we put a bleaching material inside the tooth that leaks bleaching components slowly, and that slowly takes care of the discoloration.
So if someone has one tooth in the front, maybe
Hmm.
from falling down, from something, hitting their front tooth,
Hmm.
that tooth can die and eventually the tooth will change colors. This can
Hmm.
happen years after,
Yes, yes.
right? So after the trauma occurs, the tooth is essentially dead. It still feels and acts like a normal tooth, but it'll turn gray or darker. And so a root canal procedure will actually help clean out. It's like a
Mm-hmm.
bruise inside the
Right,
tooth,
right,
right?
right.
It cleans out the inside of the tooth. And in order to get that tooth to whiten and lighten, we can do a procedure called internal bleaching.
Internal bleaching, yeah, which is basically happens, after we do the root canal, we clean the tooth out from inside, place a nice filling, and then, in the top portion of the tooth, we place a bleaching material. It's not a one-time thing. So basically, you have to come back, within few weeks, and then we have to change that bleaching gel we put inside.
But you can lighten a tooth that
You
has
can
had
light,
trauma to it.
of course, you
That's
can.
amazing.
Hmm.
And let's talk about why some root canal procedures fail. It's really it's very interesting to see how many canals are inside of a tooth. So front teeth usually have one canal, which means if you need to do a root canal, you only need to clean one pipe,
Yeah.
right? Essentially.
Yes.
That's the way I imagine it.
Mm-hmm,
And now as you start to move into some of the back teeth, inside that tooth, there are multiple canals.
right.
So, and when you get into the molars, you can have 4 or 5 or 6 canals. So let's say the dentist does an excellent job cleaning 4 canals, but leaves 2 of those canals still dirty, still with bacteria in it. That whole entire tooth can fail, right? Which is why it's important that a root canal specialist with specific microscopes, with specific three-dimensional CT scans, is able to identify how many canals the tooth has
Right.
and ensure that every single canal is properly cleaned and filled.
That's very true because, as I said, canals are like tiny spaces that harbor bacteria. So let's say if tooth has like 4 canals and you only clean and, fill 3, there is still a space in the 4th one to harbor bacteria, and that root canal for sure is going to fail. That's one reason, the root canals fail. Though I said, if, nicely done root canal with nicely crown put on, the root canals are very successful. They're like 94-95% successful. But then, as I said, first factor was, if we did not clean out the tooth properly, that's one reason it could fail. Another is if we do not seal the tooth after, which means if we do not place a permanent filling, if the patient does not get a crown done within, a couple of weeks, then what happens is our saliva is full of bacteria. It leaks in and then it can reinfect even the best looking root canal. That's why it's important, to get a good seal, permanent filling, and a crown, within a couple of weeks after the root canal so that the root canal doesn't fail.
So sometimes when patients have pain, they get a root canal. The root canal procedure is extremely successful. We clean inside the tooth. We save the tooth. We get them out of pain. And in order to finish that entire procedure, we tell them, hey, you still need to get a crown, right? So a lot of times they're out of pain and they never show up for the crown.
That's very true. Life comes in the way. Sometimes they don't have time to do the crown. But what happens is when we do the root canal, we take all the moisture out of the tooth. The nerve is out. The tooth is more brittle now. So if you keep on using your chewing forces on that tooth that does not have a protection, as we talked about, like a crown, the tooth is going to break. So all the hard work I did or you went through, it's just going to be a waste.
So most teeth after a root canal should receive a crown.
All the teeth.
All the teeth.
All the
Okay.
teeth.
And so, I mean, patients who can't afford a crown, should they even do the root canal at the beginning, or will they just buy them time? What can they do as an interim procedure as they're saving up for the crown?
I would recommend at least get a permanent filling done so that we know the tooth is sealed while they're waiting for the crown. And I would be very careful about chewing on that side. So I would just chew on the other side so that we are babysitting, babying the tooth.
Until we can get a permanent
Until
crown.
we can get a permanent.
So one of the things that is like a silent epidemic is people who clench and grind their teeth. Right. And so we can exert up to 250 pounds of pressure at night without knowing,
That's very
right?
true.
When stress, side effect of medications, coffee, we've just had a bad day or our posture
Sure.
is not right, right? So these patients are sleeping at night and clenching their teeth at full force. And this puts a lot of pressure onto the teeth. And so we actually start to see some of the teeth cracking and
Mhm,
breaking.
mhm.
A lot of times we can see the teeth are starting to get flat.
Sure.
And so let's talk about the importance of addressing nighttime clenching and bruxism by wearing a night guard.
Sure, you're absolutely right. As you know, life gets busier. These days, every person has a lot of stress, so that comes out in clenching and grinding at night. And you said, there's a lot of pressure on the teeth, and the teeth can actually give in and start cracking. So I would say, those people who are prone to that, and we can diagnose this in the office very, very easily. As you said, they have flat surfaces, all their teeth are worn down. So whenever we see those patients, we recommend night guard, which means, it's a cushion. The teeth don't clench together, they don't grind together. That way, we protect the teeth from breaking.
So basically, a night guard is like a tooth pillow, right? So
Hmm.
instead of having your upper teeth and lower teeth grinding and
Or
clenching to
even
each
touching
other,
with each other.
and
Yes.
just even touching each other,
Right.
a night guard is a simple appliance that you can just wear
That
over your
relieves,
teeth.
yes, yes. So basically, it relieves all the pressure, you were going to put on the teeth when you were grinding.
And so, what are some of the signs and symptoms of people who are grinding and clenching? Is I know a lot of people wake up with tremendous headaches or
Hmm.
sore muscles. In your experience, what are some of the signs and symptoms that you see most often with people who clench and grind their teeth?
Yes, that's very true. Sometimes a patient comes and say, I have pain in all my teeth, especially when I wake up and it gradually, dissipates throughout the day. That's one. Or when we do an exam, the teeth will have, multiple hairline cracks in the teeth, or what we call them wear facets, which means, their teeth are like very shiny and worn down. All those things, we can basically diagnose grinding with. Or if you touch their TMJ, the joint on both sides, sometimes it's like very tender because of the grinding as well. So I would say, all these signs and symptoms basically I would watch out for.
And tell us about how you use Botox for this.
You probably would be surprised to hear, we have Botox for people who grind and clench their teeth because, the grinding and clenching, it causes a lot of muscle tension in the masseter muscle, which we have here. So we can actually, inject Botox that kind of relieves that tension and, patients feel much better. Now you can see the Botox is not only for, wrinkles and fine lines or cosmetic. We can actually use them in dentistry as well and help patients a lot with that.
Amazing. So tell me a little bit about lasers and some of the different ways that lasers are used in your practice.
So lasers, we can actually use lasers to for the fillings. Now we don't have to use that noisy vibration. The drill. We can actually cut the tooth with laser. It's very clean, no noise, very conservative, and then that's one way. To use laser in dentistry, that we can do fillings after using laser. Lasers are very helpful in cleaning the canals when we do the root canals. They help get rid of the bacteria, and we can that's one way we can use them. And if you have inflammation of gums or periodontal disease, lasers help take care of that as well. So basically we recommend laser treatment after you get your deep cleanings.
And tell us about how you use local antibiotics like Arestin, and how they're placed underneath the gums to help reduce in a local manner the bacterial load underneath the gums.
Sure, it's funny, some patients come and they can ask, okay, if my gums have infection, why can't you just give me, antibiotics and it's going to be all good? So I always tell them, the antibiotics are systemic. They don't get to the bacteria that are inside our tooth, or they are, inside our gums. For that, we need something that's local and we can place in direct contact with the bacteria. So that's what we do. If a patient has deep pockets, after we do the deep cleaning, we place, Arrested, which is a local antibiotic, so that it stays there for a longer period of time and, kills the bacteria and the gums.
Now tell us about bone loss, and how it's caused from periodontal, inflammation, and if you don't go get your regular cleanings, what ends up happening and the teeth end up becoming loose.
Sure. So what happens is, it all starts with plaque, which is loose debris. If we don't clean that, bacteria get onto that and slowly it hardens. When it hardens, we harbor more and more bacteria, and bacteria love, eating up your bone, and that's what they do. If you don't get those bacteria out of your mouth by cleanings or deep cleanings, they're going to keep eating up your bone, and that's when you lose bone support, around your tooth, and the teeth will become loose.
So the teeth actually get
They can fall off
loose, they
to
can
a point.
fall out.
Yes.
So the process of bone loss, happens slowly or quickly depending on the person.
Every person is different.
Correct. And so getting regular cleanings is the number one way to reduce bone loss.
Yes, and that's important when we diagnose, because every person's susceptibility to bone disease or the gum disease is different. So that's when we diagnose which patients need, maintenance cleanings. So if patient is more prone to the bone loss, then we, as I said, we put them on the maintenance plan, which is like every 3 months clean. So all this is basically to get rid of the bacteria. If patient is more prone to get bacteria in their mouth, so we see them more often than the others.
So tell us about dental implants, how they're used and the different ways that we use dental implants in dentistry.
Sure. So dental implants is one way to replace your missing tooth. So basically, if the decay or the infection it gets to a point where we cannot save your tooth, then we have to pull the tooth, and then implant is, as I said, it's one way to replace that missing tooth. It's basically, it looks like a real tooth. It's a lifetime solution, very predictable. Close to 98% success rate.
And how are dental implants used to secure dentures?
So what happens is when you lose teeth, you lose your bone as well. So the traditional dentures sometimes hard to make because there is not enough bone, and the dentures will be loose. So dental implants take care of that problem. You put dental implants in the bone, you give a good support, and then you do the dentures that rest on the implants rather than getting support from your actual bone. And dental implants basically they help retain the dentures.
And if someone has been wearing dentures for a long time, what can we do to just get rid of the dentures and get teeth that actually stay in?
Sure. So if a person has been wearing a denture for a long time, one thing they have is not enough bone, because even with wearing dentures, you keep on losing bone. So what we do is, we see, how much bone do they have, because sometimes if we have to place implant, we have to do the bone augmentation, which means we have to build up the bone a little bit. So we have different options. They can wear removable dentures, which is still implant supported, but they still have to put in and take it out. Basically, the denture click onto the implant, but it's still denture. It's removable. But we have options of fixed bridge as well, which means we do. Place implants, and then on those top of implants we place a bridge, which is a fixed. Patient does not have to take it out or put that back in.
So what you're saying, in your office, you can get implants, throw away your denture, and
Yes.
get permanent teeth that don't come in and out,
Mhm.
that look and feel like a natural tooth, and you can actually start tasting your food again. You can chew
Exactly.
foods easier. And how long does it take to do this procedure?
It depends on every person. Sometimes we can do immediate implants, which means, after doing the extractions, we can place implants right away. But on an average, I would say it takes about, 2 to 6 months for the whole procedure to be complete.
And what if your teeth they look good and it's just gotten yellow over time? What options do you have to whiten and brighten the teeth?
Yeah, great question. It's all about cosmetics these days. So basically, if the people have stains or their teeth are yellow, we have in-house whitening options. We can bring the patient, we can whiten their teeth in the office, and to maintain that, we can give them whitening trays they can use at home as well.
What type of foods or drinks should people avoid if they don't want to get, staining on their teeth?
Sure, we all know coffee, tea, wines, they all stain teeth. So I would say if they don't want, stains or, discolored teeth, I would say stay away from those.
Okay. And then, tell us a little bit about, wisdom teeth. Tell us, like, when's a good time to remove them, and what kind of problems do wisdom teeth cause?
Sure, I always call wisdom teeth troublemakers. So I would get them out as soon as they're in. So when, a kid turns 17 or 18, the wisdom teeth start coming in. That's the best time to take them out because at that time the roots are not formed yet. So it's easier to take them out. Once the roots are formed, they could be curved, they could be embedded in the bone. So it's we can still take them out, but it's a little complicated and difficult extraction. So I would say the best time is as soon as they come into the mouth. I would take them out.
And one of the amazing things that, I see dentists doing now is, bringing in the specialists to their office. So instead of having to send patients around town to different specialists, uh, dentists now invite specialists to come to their office so that everyone can communicate better. It actually reduces some of the costs and expenses, and it's really incredible to see specialists of different kind come together
Hmm.
in more of a group practice setting and providing dental care in one place, under the supervision and care of one office,
Sure.
and really helps bring not only better quality services sometimes, but also brings down the cost. And so, tell us about your office and how you're bringing in specialists of different
Sure.
kinds to better serve your patients.
Yes, I'm glad you touched on that. Now it's not about, one tooth or, one problem or just the gum disease. It's the comprehensive care we are looking for and the patients are looking for as well. We take care of all these specialty treatment needs in our office, and we have different specialists who come over. We have oral surgeon who comes over for the extractions, implants, bone grafts, or any other surgical procedure the patients need. I'm an endodontist. I'm always there. I take care if the patient needs root canals. We have an orthodontist who comes in and she takes care of the patients who need braces. So that makes it very convenient for the patient because they don't have to refer out to different specialists for like different specialty needs. So we have everything, under one roof. So it's for patients' convenience, easier communication, whatever the dental needs for the patient, so that we can address that the best way we can.
Now, I know one of the biggest challenges in dentistry is the costs, is wanting to do the right thing for the patient, but sometimes it being cost prohibitive. And I understand your office offers payment plans to patients to allow them to get the care that they need when they need it most, and pay over time. And it's a really wonderful thing that you guys do for your patients. How does that work?
Yes, sometimes, we all get into these situations. It's sometimes it's hard to pay a big chunk, at the same time. So we have no interest payment plans in the office. If the patients need, we can get them approved and they can pay on monthly basis, or they can set it up however they want it without any burden on them. So we can split the payments over a period of time to make it convenient and comfortable for them
That's incredible. So people can get the care they need when they need it, even if it's an emergency,
without thinking, how are they going to pay for the full
without having to
treatment
sell
fee.
their house to
It's
pay for their dental work.
exactly.
That's incredible. And so, if the insurance also, doesn't cover a portion of their treatment, How do you guys do that? You check the patient's information first, you check their insurance, and then tell them what they need. Are there any surprises that people have to worry about at your office?
My managers or my front staff office, they are experts in that. Before the patient walks in, we work on to checking all the benefits they have, how much is covered, whatnot, so that the patient gets best benefit from their insurance. But as I said, even if they cannot have everything covered by their insurance, we have, payment plans. But my, front office staff is very, very thorough on that, and they will do every possible thing, to make it convenient and easier for the patient.
And one of the things I'm really amazed at your office is that you guys speak so many different languages to be able to communicate with your patients about really what they need in a language that they understand. What languages does your office communicate with, and why is that important to you?
Everybody speaks English, and because my office is in Hispanic area, which I love, yeah, all my staff, they speak Spanish as well. I think it's important to communicate with the patient in their language because that's how you gain their trust. That's how you make rapport with them. It's important to have that comfortable relationship. If you speak in their language, so that they can express themselves and you can understand, what they're looking for, basically.
That's amazing. That's amazing. And what are your hours? What days are people open, and can they see you maybe on weekends?
Yes, we are open every day. So that's the best part, and that's what our patients like about our office as well. Normally, we open from 9 until 6, but we are available, after hours as well. That's why we are big on, treating emergencies because we sometimes we get calls after hours. We are able to bring patient in right away. My dentist and the specialist, they are a phone call away. If we need to bring them in the office, they are available. And I just want my patients to know that we are open every day of the week for their convenience.
That's amazing.
Hmm.
Well, doctor, thank you so much for joining us. I know it takes a lot to from your busy schedule to come join us, but it's incredible to know you. It's incredible to know that people like you are serving the community in Santa Ana. And for those who are looking for an incredible dentist, Dr. Rashi Vohra, a local dental hero, thank you so much for joining us, and we hope to have you back very soon.
Thank you very much for having me. Thank you.
Wonderful.